Thank you very much for that. I'm now going to introduce to you Jessica Hickey, and Jessica is going to speak to you about a topic that's close to my heart, which is implementing aphasia recommendations in the acute setting, a participant evaluation of how process and context influenced behaviour change intervention. Thanks, Jessica.
Good morning, everyone. Before I begin, I'd like to acknowledge the work and support of Kirstine Shrubsole, Emma Power and Linda Worrell in this research. So evidence practice gaps have been identified in the implementation of post-stroke aphasia guideline recommendations. Implementation interventions aim to reduce these evidence practice gaps by increasing the uptake of research by healthcare professionals. And this is achieved by changing healthcare professionals' behaviours. The mechanisms by which behaviour change occurs needs further research to better improve our understanding of a successful implementation. To complement quantitative-based outcomes, a process evaluation is recommended to understand the mechanisms of impact and contextual factors influencing implementation. They can provide insights into why or why not the intervention didn't work, the key ingredients perceived by the participants, and contextual factors. Several implementation studies have attempted to address these evidence practice gaps in aphasia management. However, none of these have previously used a process evaluation to interpret findings. The acute aphasia implementation study AIMS was a pilot cluster randomised control trial which examined a tailored implementation intervention to improve speech pathologists' uptake of evidence for two aphasia recommended guidelines: information, education and aphasia-friendly information, and secondly, collaborative goal setting. This intervention included a tailored workshop for each team, followed by a 3 to 6 month implementation phase. So the aim of this present study was to understand the nature of the impact of the implementation intervention as perceived by the speech pathologists who participated in the AIMS. And this was largely achieved through using components of a traditional process evaluation, a qualitative one. Focus groups were conducted at the end of the implementation phase for each of the 4 acute speech pathology teams to understand their perceptions on the feasibility, acceptability and potential effectiveness of the implementation intervention. And content analysis was chosen to understand the themes. So the results provide some insights into how behaviour change occurs for clinicians. 6 interrelated themes were identified, including the speech pathologist's understanding of the workshop facilitators, such as the accessibility and face-to-face mode of the workshop. Secondly, their understanding of the impact of the workshop on clinical practice, such as the consumer video. Thirdly, their understanding of how implementation was facilitated, such as accessible and tailored resources. Alongside these were perceived challenges which did affect the workshop's phase and the implementation, such as time and the nature of the acute setting. Altogether, they did perceive a change in practice, and this was evidenced by a generalisation to practice across other areas and reports that change was sustainable and ingrained. Finally, the focus group, understanding that this acted as a follow-up reflective opportunity, which in this study served to better understand the nature of collaborative goal setting. So what does this mean in clinical practice? The speech pathologists identified key elements which should be considered in future implementation interventions. Firstly, local barriers and facilitators should be identified to ensure targeted implementation interventions. The workshop was a feasible implementation strategy, reported to be accessible and tailored. And team learning through the face-to-face workshop was acceptable, and speech pathologist perceptions indicated that the workshop strategies, such as practical and interactive activities, contributed to the practice change. Accessible resources address the established time barrier, and speech pathologists reported a preference to printed, portable and centrally located resources. Documentation strategies, including templates and patient documentation and handover, were effective in order to improve as reminders. Finally, a follow-up session post-workshop is recommended in order to monitor progress and detect difficulties in order to better improve implementation. In conclusion, the identification of possible mechanisms of action and contextual factors provide direction for future implementation interventions. There is still much research to be done in aphasia implementation interventions in order to close the evidence practice gap. Thank you.
Our final speaker in this lightning session is Emma Power.